These photos of healthcare workers in Florida trying to protect themselves from COVID-19 by wearing trash bags as gowns and masks made from paper towels drove Jude Durisme to action. He's the vice president of the local union representing healthcare workers.
Yesterday, I got a call from one of the nurses. This was a respiratory therapist that told me that she pretty much had to walk off the floor because she felt like her life was being put in danger. We were concerned about what was going on with cross-contamination, so we filed a complaint with OSHA.
From here.
OSHA is the Occupational Safety and Health Administration, the federal agency charged with protecting workers. OSHA says it received more than 48,000 pandemic-related complaints through December 10th. OSHA publishes those complaints. A worker at a grocery store in Denver warned OSHA the employer wasn't allowing people to physically distance and not limiting the number of customers inside. At a Veterans Medical Center in Tampa, Florida, a worker said employees are not given access to necessary personal protective equipment. And one worker at a sausage company in Kansas City, Missouri, reported people are coming to work sick. Of those 48,000 pandemic complaints, OSHA has performed an inspection for only about 2,000 of them. The lack of action at OSHA isn't confined to the pandemic. Through the first 11 months of 2020, OSHA had only inspected about 55% as many inspections of all kinds that it had conducted through the same period in 2019.
OSHA is the federal agency charged with protecting workers, and it's just been a dismal failure.
Roger Curson is the communications director at the National Council for Occupational Safety and Health, an advocacy group trying to prevent workplace injuries.
Workers are sick, they're dying, they're broke because they're sick.
We're not going to break the chain of this pandemic until we deal with the exposures in the workplace.
Peg Seminario is the former health and safety director for the AFL-CIO. She's also the co-author of a paper published in November in the European Journal of Epidemiology. The researchers found dangers on the job were a factor in community spread and an early warning.
What we saw was throughout the country that the OSHA complaints were highly correlated. They were predictor of deaths that were going to occur a couple of weeks later.
As of mid-December, OSHA reported COVID-related citations for 263 employers nationwide. The fines totaling $3.5 million. That might sound like a lot of money, but these penalties are modest by the standards of big business. In one example, 6 workers died after contracting COVID at a JBS meatpacking plant in Greeley, Colorado. OSHA found inadequate protections for workers and the plant didn't properly log injuries. The fine? Just under $16,000.
The message to employees, well, this isn't going to cost very much, so we're not going to bother going through anything that we'd have to go through to reduce this risk a lot.
OSHA denied our request to interview the agency's director or staff. In a statement, an OSHA spokesperson said, the agency utilizes existing safety and health standards and considers CDC guidelines when determining violations of workplace safety requirements as they relate to COVID-19. The statement said every complaint is investigated and inspections alone have helped to ensure more than 618,000 workers are protected from COVID-19. The spokesperson also pointed out that by law, OSHA has 6 months to complete an investigation. OSHA has opted not to create any standards specific for the pandemic. At least 22 states and territories operate their own occupational and safety health offices with federal oversight. At least one state, Utah, has pointed that lack of federal guidance as a reason to not pursue unsafe workplaces more aggressively.
Yeah, rules and regulations on the state and federal level regarding COVID, there aren't any yet in place for us to follow.
According to the National Employment Law Project, 14 states have already adopted more stringent workplace standards than federal regulation requires.
Virginia issued a very, very strong standard back in July about protecting workers. California just issued one. The state of Michigan has issued a standard.
Could OSHA mandate masks in every workplace in this country?
I think the approach that OSHA would take would be more likely to say every employer has to have a plan that's specific for that workplace. Let's say you're a trucking company. The guy doesn't have to wear a mask while he's in the truck cab by him or herself. When they get to the terminal and others are around, then you should have the mask on.
The vaccine is not gonna just make everything magically disappear.
No COVID-19 standards have been issued for workplaces in Florida. When Jude Durisme tried to file an OSHA complaint on behalf of his union members, someone from the agency's offices in the Sunshine State returned his call. But the response, left in a voicemail, wasn't what Durisme was expecting. Despite OSHA saying it investigates every complaint, this is what the staffer said.
Good afternoon. This is the duty officer from the OSHA office in Fort Lauderdale. In regards to your complaint this morning, actually we are not performing any inspections or any type of enforcement regarding coronavirus.
In Salt Lake City, I'm Nate Carlisle.
Wow, surprising. If you are a Utah worker concerned about health and safety at your job, you can file an anonymous complaint at the number on your screen, 801-530-6901. We'll post a link on our website that will take you to an online complaint form as well.
Now, if you have a story you'd like Fox 13 News to investigate, email iTeam@fox13now.com. You can also call our tip line at 801-536-1314.